can this medication cause swollen lymph nodes as a side effect? Swollen lymph nodes are not a recognised side effect of Mounjaro according to UK regulatory data and clinical trials. If you're taking Mounjaro and notice swollen lymph nodes, it's natural to wonder if your medication might be the cause. Let's look at what the evidence actually tells us. Mounjaro, known as tirzepatide, is a dual GIP and GLP-1 receptor agonist licensed in the UK for treating type 2 diabetes. It works by enhancing insulin secretion when blood glucose is elevated, suppressing glucagon release, slowing how quickly your stomach empties, and reducing appetite. This combination helps improve blood sugar control and can support weight reduction. Now, like all medications, Mounjaro does come with side effects. The most common ones are gastrointestinal. We're talking about nausea, vomiting, diarrhea, constipation, abdominal pain, reduced appetite, indigestion, and sometimes fatigue. You might also notice reactions at the injection site like redness or irritation. These symptoms are particularly common when you're first starting the medication or increasing your dose, and they typically improve as your body adjusts. But here's the important bit about lymph nodes. Swollen lymph nodes are not listed as a recognised side effect of Mounjaro. This isn't in the UK summary of product characteristics or the European Public Assessment Report, and it wasn't reported in the major clinical trials for tirzepatide, including the SURPASS and SURMOUNT studies. So if you're experiencing swollen lymph nodes whilst taking Mounjaro, it's more likely due to another cause. Speak to your GP so it can be properly assessed. Lymph nodes are part of your immune system and they swell for all sorts of reasons. The most common cause is infection, whether that's a cold, flu, throat infection, or even a dental issue. Your lymph nodes are doing their job, fighting off whatever's bothering your body. Recent vaccinations can also cause temporary lymph node swelling, particularly in the armpit on the side where you received the jab. Local inflammation or skin infections near the lymph nodes might trigger swelling too. Now, certain characteristics of swollen lymph nodes do warrant medical attention. If your lymph nodes are persistently enlarged and not going down after a few weeks, that's worth checking out. If they're getting bigger rather than smaller, or if they feel hard or fixed in place rather than movable, you should see your GP. The same goes if you're experiencing other symptoms alongside the swelling, like unexplained weight loss, night sweats, persistent fever, or if you're feeling generally unwell, and seek urgent medical advice if the swelling is above your collarbone, you're having difficulty breathing or swallowing, or if multiple areas are affected. For urgent concerns, contact NHS 111 or, in an emergency, call 999. Your doctor can examine you properly, take your medical history, and determine whether any tests are needed to rule out more serious underlying causes. If you do notice swollen lymph nodes or any other unexpected symptoms whilst taking Mounjaro, it's important to report this through the MHRA Yellow Card scheme. You can search for MHRA Yellow Card online. This helps with ongoing safety monitoring of medications and contributes to our understanding of how medicines affect people in real-world use. When it comes to managing side effects from Mounjaro itself, the gastrointestinal ones are what you're most likely to encounter. If you're struggling with nausea, eating smaller, more frequent meals can help. Avoiding fatty or spicy foods might ease symptoms too. Staying well hydrated is crucial, especially if you're experiencing vomiting or diarrhea, as dehydration can lead to more serious complications. If you're taking Mounjaro alongside insulin or sulfonylurias, be aware that your risk of low blood sugar increases. Your doctor may need to adjust your other medications when you start tirzepatide. Always speak to your healthcare professional about any side effects you're experiencing. They can provide personalised advice based on your individual circumstances and medical history. Never adjust your dose or stop taking Mounjaro without consulting your doctor first. So, to recap, swollen lymph nodes are not a recognised side effect of Mounjaro according to UK regulatory data and clinical trials. If you notice lymph node swelling, it's more likely due to an infection or another cause that needs proper assessment. However, persistent, enlarging, or hard lymph nodes should always be evaluated by your GP, and certain red flags require urgent medical attention. Have you experienced any unexpected symptoms whilst taking diabetes medication? Drop a comment below. And if you found this helpful, please give it a like and subscribe for more evidence-based health information from Bolt Pharmacy.